Hi YouTube, and welcome to my channel. If you're a nurse interested in switching your career path, or a new nurse looking into getting into the field of aesthetics, then there may be something in this video for you. This video will be about my journey transitioning from bedside nursing to aesthetics nursing and providing you with a few tips that may help with your journey along the way. So my name is Jennifer and I'm a registered practical nurse in the province of Ontario, and I currently work as a clinic lead nurse / physician assistant in a busy cosmetic clinic just outside of Toronto. So my career up until this point has been filled with many different roles, including floor nurse in long-term care, clinical coach for Behavioral Supports Ontario, private home care, and working in the hospital the last 3.5 years, and now currently an aesthetic nurse and nurse injector. I'm not going to go too much into my past nursing experience in this video, but I'm more going to focus on the steps that I took to become an aesthetic nurse from bedside nurse. So this field of nursing piqued my interest last summer, and I took to the internet and to YouTube to start researching it and learn more information about it. I started with researching accredited schools and associations in Toronto that offered aesthetic courses to nurses. So of course I took to YouTube and I started researching other nurses that have taken this avenue. So two of the nurses that I started watching on YouTube are Nurse Nadia K and Elizabeth Marie RN. So I will link their YouTube channels below because they had some great tips that helped me along my way. So I took advice from these videos that I watched, and some advice that Elizabeth Marie had in one of her videos was to start researching local injectors in your city or in your area and start familiarizing yourself with them, and also look into getting a treatment yourself. I thought that this was a great idea to introduce myself into this field instead of spending potentially thousands of dollars and then realizing that I don't like the industry, I don't like the environment or the field of aesthetics itself. So I started researching clinics in my area. I talked to some of my friends, got their recommendations on local injectors, and then sought out my first Botox treatment at a local injector. Well, I didn't know it was Botox that I wanted at the time. I thought that it might be filler, but to be honest, I wasn't really very educated in either. So my first Botox treatment was in my DAO muscles, and then here this was to improve the appearance of like a downward smile, and which causes marionette lines over time. And then Botox here is to improve the appearance of my gummy smile, because I was always pretty self-conscious about that, and that was just one little thing that bothered me. The treatment went really well and I was really happy with it, and it really boosted my confidence, and I thought to myself, you know what, I think I can do this, and I think I can help people to feel just a little bit happier about themselves with something very small. After this, I made the decision to enroll in a basic neuromodulators and dermal fillers course for nurses with an association in Toronto. After completing my training in December 2023, which was anatomy-based theory work and then 2 days of practical training in Toronto, I took Nurse Nadia K's advice and started creating a nursing aesthetics resume. I compiled all of my skills that would be relevant to a nurse injector's position, which included experience with different routes of injections, patient assessment skills, communication skills, etc., and began searching online for positions. So I would recommend looking online, private messaging any clinics, or going in person with your resume when applying. I only looked online and started to become discouraged as there were a lot of applicants applying for these positions and I didn't get any leads. I was also lacking the confidence to succeed as a nurse injector at the time because I'd been trained, but I had no substantial practical experience. And as most of us know, as nurses, it takes experience, practice, and repetition to really excel at our skills. So after this period of becoming discouraged and applying to many job postings, not hearing anything back, I decided I just need to keep searching and keep checking online job postings, because at this point I was still very busy working at the hospital. I finally came across a posting for clinic lead nurse slash physician assistant. I was immediately attracted to this position. It was 10 minutes from my house and I applied right away. After 2 interviews and several weeks of waiting, I found out that I was a successful candidate. So I've been working this position coming up on 3 months, and I've already learned so much from the doctor. The physician I work for is absolutely wonderful, and I feel blessed to be learning from her and working in such a good, positive environment. Almost all the patients we have come in happy and leave even happier. With all of that being said, my advice for nurses interested in transitioning into this field are: first, I would say go and get a treatment done yourself, as it will help to gain insight on whether this is an environment you feel comfortable in and how it feels to experience a treatment, so that you can be on the other side of it and actually be the patient. Number 2, I would say research education opportunities in your area. If there are physicians offering hands-on mentorship training, I would reach out to them. And I'd highly recommend this, as this is the experience and learning that will be invaluable to your practice in the future. And third, create an aesthetics resume separate from your nursing resume. And 4, create an Instagram page to start advertising yourself and your services. Even if you're not practicing yet, it doesn't hurt to start an Instagram page and get your name out there. And begin applying to clinics. Don't give up on your job search, because the perfect job will find you if you're truly passionate, and if this is something that you want, you will make it happen. And my last tip, something that has been really helpful for me, especially as a beginner aesthetic nurse, is to start following advanced or experienced physicians, nurse practitioners, or nurse injectors to stay on top of trends, injection techniques, and any opportunities for continuous and advanced learning. I hope that this video was helpful to you, and if you have any questions, please leave them in the comments and I will be sure to answer them. Thank you so much for watching, and have a wonderful day.